Well, we begin this news hour in eastern Libya, where communities devastated by the tsunami-like floods there are slowly trying to recover. Aid agencies have been warning of a potential health crisis from waterborne diseases, with unclaimed bodies scattered under the debris and washing up on shores. Search and rescue teams in Derna have been working non-stop. The coastal city is historically and culturally significant. It was one of Libya's wealthiest and was home to at least 90,000 people before these floods. Business from port operations kept that region active despite Libya's 9-year conflict. And the city then had more than 4,300 buildings. Now, much of it is in ruins. Well, when Storm Daniel ripped through Derna on Monday, its 2 dams burst, unleashing nearly 30 million cubic meters of water. That's the equivalent of 12,000 Olympic-sized swimming pools. It's estimated that a quarter of the city's structures are now either partially or completely destroyed. The death toll is in the several thousands. Charles Stratford begins our coverage.
Thousands of people are still missing and feared dead, buried under the mud and rubble or swept out to sea. Search and rescue efforts continue, but the chances of finding people trapped and alive are increasingly slim.
That's why we are working as hard as we can in these few hours, that we'll have safety margins to be able to locate people alive. And we're trying to squeeze our dogs as much as possible to work on those buildings that have been partially destroyed and which have not been completely submerged by the water.
The wall of water carried many people out to sea. Their bodies lie on beaches, having been washed ashore.
This is the first time we see a disaster as big as this in Libya. We are facing difficulties in the sea. We are waiting for the sea to calm down to be able to see the bodies and try to retrieve them.
Survivors recount the terrifying moment their loved ones were taken away.
My life before was stable. I had my house and my family, but now there is nothing. There's no life anymore.
There is mounting fear of disease as the hidden bodies decompose.
We must be absolutely cautious and at the same time act with total responsibility in addressing the sources of pollution, from the dead bodies under the debris to animals' carcasses, in addition to any chemical materials washed away by the floods.
Libyans from the west of the country have driven across front lines determined to help those in need in this politically divided nation. But just getting the aid to where it's needed most remains a huge challenge.
Security forces and the army are doing their best to restore the roads leading into the city. The catastrophe is massive, and as a result, access to many areas is not possible.
Foreign aid continues to arrive by air, but Derna needs more international assistance, and fast.
We need the support of the international community. We need the support of the UN agencies in order to be able to manage this crisis in a proper way and to help Libyans overcome this unfortunate incident.
Survivors struggle to comprehend this catastrophe, clearing the mud and debris from what remains of their homes and waiting for help. Charles Stratford, Al Jazeera.
Well, let's speak to our correspondent, Rasul Serda. He is in the capital, Tripoli. Rasul, can you give us an update as to where we are with the recovery operation now in Derna? I know there's been talk of a potential full evacuation.
Indeed, now the evacuation, the rescue operations are still underway, but now the main concern in the city of Derna is the health issue, because it is deteriorating so rapidly. And as days have passed since the disaster, now the dead bodies are decomposing, and that is posing a huge threat. But then experts, the officials here are warning that this could lead to an environmental disaster that could cost many more lives. And earlier today, we have spoken to the deputy, the mayor of the city of Derna, Ahmed Madroud, and he said that there are now expectations for the city of Derna to be evacuated in anticipation of a spread of an epidemic from the waterborne diseases. And now, by every hour passing, this is becoming a real possibility here, because many people believe that this could be the only way to avoid another disaster. However, this is going to be a huge task, a very difficult task, because just in the city of Derna, there are more than 30,000 people displaced, and thousands of other people are still searching for their loved ones, at least to have their bodies. And much of the city is still not even searched and checked. So that's why it's not easy to evacuate the city that is hit by the disaster.
Rasool Serda there with the latest for us from the Libyan capital, Tripoli. Thank you, Rasool. Well, let's bring in Georgette Gagnon. She's the UN humanitarian coordinator in Libya. She also joins us now from Tripoli. Georgette, thank you so much for your time. I know it's incredibly busy. We know the destruction stretches beyond Derna. We've been hearing about ongoing power outages, blocked roads, and I see from the UN's flash appeal in Al-Baida, even the emergency and ambulance headquarters partially collapsed. In Sousse, the entire city submerged in water. Are these areas now getting help?
Yes, they are. In fact, today we have a team in Sousse. They arrived. We also have a team in Al-Baida, and they have brought in some supplies. And of course, they're there to see with local authorities, with the communities, what else needs to be brought in quickly to support the people there.
Georgette, we've been hearing a lot about a potential health crisis. What are your most pressing health concerns? I understand that the bodies aren't potentially the biggest threat here.
Yes, and you may have seen that the World Health Organization and the International Committee of the Red Cross issued a statement about that today. The most important issue is the contaminated water, that water is contaminated from a number of sources, and that people are not drinking tap water, and that they have potable water that they can drink to avoid and prevent, as the first speaker said, waterborne diseases. We really want to prevent a secondary health crisis.
Georgette, we're going to get into that in just a moment, actually, with Margaret Harris from the World Health Organization. But for now, let me ask you about some of the less obvious dangers, too. In the last hour, I spoke to the head of the Libyan delegation of the ICRC. He was telling me about unexploded ordnance from the war now being dislodged and lost there in the floodwater. How real a threat is that in Derna?
Well, according to UNMAS, this is the UN Mine Action Center, which works with LibMac, the Libyan Mine Action Center. This is a very real concern, and they are now planning to come and try and do some tracking and demining in the area when it's possible. But certainly there needs to be a focus on this because, of course, it presents a very serious hazard, not only to the people who are still in the area, but to those who need to be there rebuilding, and of course the aid community and the first responders.
Georgette, we were hearing there from our correspondent Rasool that a full evacuation of Derna is being considered. That would be a huge operation. I know you're already supporting other smaller evacuations. Would you have the capacity to deal with something on that scale?
Well, if the local authorities requested support on that, we would certainly consider it, and we would discuss with them how that could be done. But any type of evacuation would be based on their request, and then we would have to really look at what the possibilities are. But of course, if it's needed to avoid widespread concerns in the health area, it needs to be considered.
Sure. Georgette, you are the UN humanitarian coordinator in the country. Let me ask you, this is a very divided country. You're dealing with two rival administrations. How has that been going? Has there been coordination? And beyond that, what is the mood like and the conversation between these two rival administrations as we deal with this?
Well, our experience is that Libyans from all across the country, at the local level, in the communities, in the cities, have really come together in solidarity and support of their neighbors, their fellow Libyans in the affected area. The authorities in all parts of the country have come forward with support, with funding, with supplies, medical supplies, technical support. These things have all been provided. So what we're seeing is a real effort to provide support to the people affected all across the country from all Libyans, a real show of national support.
Now, Georgette, from what I heard there, it sounds like people on the ground have been coming together, and we've certainly seen that. And at the upper levels of government, there's been provision of resources. But are they actually working together? Is there the hope, potentially, that a crisis like this might be able to unify a divided country?
Well, of course. We have been highlighting how important it is that all people in the country, all the institutions, the political institutions, all the institutions really now work together with a unity of purpose, which is to support Libyans in the affected areas with recovery, with rebuilding their lives, their livelihoods. And that is really what needs to be the main focus at the moment, at this very important time.
And that was Georgette Gagnon, the UN humanitarian coordinator in Libya. Georgette, thank you so much for your time with us here on Al Jazeera, and we really wish you all the best with your work going forward. Well, let's now bring in, as promised, Dr. Margaret Harris. She's the spokeswoman for the World Health Organization. She joins us now from Geneva. Dr. Harris, as we've been hearing, these fears of disease are mounting. I know that the WHO has been cautioning against hasty burials, but there are also religious and cultural preferences here too. Can you explain your guidance?
So the first important thing to understand is that the bodies themselves don't cause the epidemics. So the people who died were healthy and they were killed by a catastrophe. So they're not carrying any diseases that are likely to cause an epidemic. Now, the contents of the gut can get into the water, but the water is polluted by many, many things. It's polluted by sewage, by all the damage and destruction. So the real problem here is that the water can't be drunk. And as the resident coordinator made it very clear, the big issue is to get clean, safe drinking water, because indeed, if people don't get that clean and safe drinking water, they will develop the many different gastrointestinal diseases carried by water and by food, because they don't have access to clean and safe water and food.
Well, let me ask you about that, because we have heard these calls for people to not drink the water, to rather drink treated or bottled water, but is there actually access to that on the ground?
Well, that's one of the things that all the humanitarian efforts are really, really racing to provide, because that's number one, clean water. Well, shelter, clean water, and of course, healthcare. That's the other thing, that we are really working to get all that as close to people where they are as quickly as possible.
Margaret, we've been hearing from doctors in Derna that they are worried about the bodies becoming a source of contamination. I see that the WHO is saying that if common precautions are taken with the bodies, that the risk of disease is then low. But are these common precautions possible? There's obviously little, if any, electricity, so no cold storage, presumably not even enough body bags, and the bodies are still lying there in the sun. Is none of that a worry?
So, of course, and you know, it's so distressing for people to see this is horrific. But remember, each one of those bodies was somebody's father, mother, child. There's a family that doesn't necessarily know what happened to them. There are social and legal requirements. So pushing and rushing to just dispose of people as if they are now a threat causes greater harm in the long term.
Sure. And obviously there are some religious and cultural preferences there. And in some Islamic cultures, you want to bury people closer to their death. And obviously there are logistical constraints around that. Let me ask you just a little bit more about this water contamination, because we've been worried about the fecal matter potentially that have been left from bodies, what's in their stomachs, as you suggested. Are there other things that worries you about what's in that water?
Oh, absolutely. When you've had buildings destroyed and you've had water rushing through, all the chemicals, all the different things that are in buildings will pollute the water. And again, sewage systems have been destroyed as everything's broken. So you've already got the sewage. And indeed, our sewage carries a lot of viruses and bacteria that you certainly do not want to be drinking.
Of course. There has been talk, I believe, of a cholera vaccination program. Has that begun?
So we're ramping up and looking at all kinds of vaccination programs, and we're looking very much at one of the other critical things is to get the child vaccination programs strengthened. So to make sure that children get vaccinated against measles and those other things. And that sounds strange, but that's critical. Again, you've got children in poor condition, cramped together. If you get a measles outbreak, that could lead to a terrific rate of sickness and death.
Derna's deputy mayor, as we've been hearing, is saying that they're considering a full evacuation of the city. Would you support that idea, or is that then just relocating many of the same health challenges elsewhere?
Our focus is really to get the things that will protect people to them where they are. So the clean water, the medical services, the medical supplies, the expertise. Get them to people so that they can start to rebuild, they can live safely and protect themselves is what we would like to see happen.
Dr. Margaret Harris there, the spokeswoman for the World Health Organization, speaking to us from Geneva. Thank you so much for joining us, Dr. Harris, and thank you for your time, and we wish your teams all the best on the ground.